Here are the 3 steps to never miss another question like this. Step 1. Recognize the drug-induced Parkinsonism symptoms. 2. Understand the mechanism of action of antipsychotics. 3. Select the appropriate treatment for Parkinsonism. So here we go. 40-year-old man treated with risperidone for schizophrenia. 1 month later, he's got muscle stiffness and a resting hand tremor. He is oriented and afebrile. What do you give him next? The answer is Benztropine, or your Benztropine. It's a classic extrapyramidal side effect. It's drug-induced Parkinsonism. That's what's happening here. So Benztropine is going to restore your dopaminergic, cholinergic balance in the basal ganglia. So you don't switch to dopamine agonists like levodopa because that'll risk worsening your psychosis. So step 1, we recognize he's got some generalized muscle stiffness, right? He's shaking his right hand. He's got drug-induced Parkinsonism. It's a common extrapyramidal side effect of antipsychotic medications, and it's used, or rather, it presents with rigidity, bradykinesia, and tremors, right? Usually it's in the first few minutes of starting some D2 receptor antagonist. Okay, then we think about what's the mechanism of action of antipsychotics. So antipsychotics, particularly your first generation agents, exert their effects primarily through the D2 receptor blockades and the nigrostriatal pathway. And this will lead to a decrease in your dopamine activity. And this blockade is responsible for these extrapyramidal side effects, including this muscle stiffness and the tremors that we see in this patient. Step 3, we select the appropriate treatment for Parkinsonism. The best treatment for drug-induced Parkinsonism is actually the use of centrally acting anticholinergic agents like Benztropine. These medications help to restore the balance between your dopamine and your acetylcholine and the nigrostriatal pathway. So that alleviates the symptoms of the rigidity and the tremors. Okay, cool beans, but why not dantrolene? Well, that's used for neuroleptic malignant syndrome. So you look for your fever, rigidity, autonomic instability, and altered mental status. So this isn't neuroleptic malignant syndrome yet. We do not see this in this patient. Propranolol and diazepam. This is used for a patient who's got this inner restlessness, this akathisia. So it's not used for Parkinsonism. Haloperidol is a first-gen antipsychotic that worsens your extrapyramidal symptoms. Levodopa is dopaminergic, yes, but it also triggers your psychosis, which the guy was suffering from initially. And so just give Benztropine. That's the best solution here. So you discontinue the offending medication and you treat them with an anticholinergic medication. All right, that's all there is, folks. Like and subscribe for more content.